Hello, everybody. I'd like to welcome you all to our webinar, Supporting Student Success Through School Health Policy. We're excited you all could join us and hope that you enjoy our webinar today. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign, which is the organization that is co-hosting today's webinar with Kaiser Permanente. But before we get started with today's content, I just wanted to first review a few logistics for today's webinar. Our session is going to be 30 minutes, so it's a quick lunch session, and the slides and recording will be available early next week, and we'll be sure to send out a link to the slides and recording, and they're also going to be archived on Kaiser Permanente's and Healthy Schools Campaign's website. Everybody should also see a chat box on their control panel. We really encourage you all to use that throughout the webinar. Send your thoughts and comments. We'll ask a few questions throughout, but really want to make sure we're hearing from you all. We have a lot of school health providers, school staff, parents, advocates on today, and really want to hear the work that you are leading in your communities around policy, particularly as it relates to education and health during the COVID-19 pandemic. Next slide, please. So we have a wonderful lineup of speakers joining us today. That is me on the left, but we are also joined by Dr. Annie Reed, who's the National Director of Thriving Schools for Kaiser Permanente, Cecilia Echeverria, who's the Executive Director for Kaiser Permanente's Institute for Health Policy, and then Dr. Erin Simon, who's the Director of Student Support Services for Long Beach Unified. Next slide, please. So today, as our webinar title describes, we're really going to dig in around how policy can be leveraged to support students during the COVID-19 pandemic. We know that the pandemic and the resulting school closures have significant implications for health and learning of students, and also the health and overall well-being of staff within schools. And policy change can really be an incredibly helpful tool for supporting districts and schools in responding to this crisis. And so we wanted to take some time today to highlight how this can happen and the opportunities presented by recent changes in policies and really what that means for districts and schools. We're also thrilled to have Dr. Erin Simon joining from Long Beach Unified District, who's really going to share a case study of what this work can look like within a school district and share what is happening within Long Beach Unified. Next slide, please. So without further ado, I'd like to hand it over to Dr. Annie Reed, who's the National Director of Thriving Schools at Kaiser, to share a little bit more about Kaiser and the work that they lead to support health and success of students and staff. Annie?
Great, thanks Alex, and hi everyone. Welcome to this week's version of our 30-minute webinar series entitled Caring for the Education Community During COVID-19, which is designed to support the physical and mental health of school communities, including teachers, staff, and students, with information and resources and strategies during school closures, and now as we start to think about what is to come in the next phase of reopening. Today's webinar is brought to you by, as Alex mentioned, Kaiser Permanente, along with Healthy Schools Campaign, and is entitled Supporting Student Success Through School Health Policy. And I'm really excited about this topic because things are moving so quickly and the policy environment is changing so fast. So really being intentional about thinking how we can use policy to support the new and emerging needs of school communities and families, and also to ensure that we're capitalizing on the silver linings that are really placing health at the center of education and making sure that it's part of the response. So thanks for being on today, and I'll just give a quick overview about Kaiser Permanente, which is the nation's largest integrated healthcare system. We provide care and coverage to over 12 million members in 8 regions across the country. And what that means is that we're on the front lines of the response to COVID-19. We're providing care for our members and even testing COVID-19 vaccines. But it also means that we really understand that what happens outside the 4 walls of our medical office buildings is critical to the health outcomes for members and for our communities at large. If you go to the next slide, really that's why at Kaiser Permanente we launched Thriving Schools, because we know that health and education are inextricably linked. If kids aren't healthy, they can't learn as well, and ultimately, obviously, kids who don't have the academic and educational attainment tend to be less healthy over the life course, and I know Ceci will get into that in just a moment. We also know that healthcare is the first front line in the response to COVID-19, but school systems are next, dealing with the health and the economic fallout of this crisis. So we're really thinking about how we can support you in the long run with your emerging needs. And part of that response is by convening this group of national partners, including Healthy Schools Campaign, to bring you this webinar series. So with that, thanks again, and I'll turn it over to Ceci Chavarria. Or back to Alex.
I'll go ahead. Yeah, next slide, please. Thank you so much, Annie, for that overview. So yes, as Annie said, I'll go ahead and hand it over to our next speaker, Cecilia Echeverria. Ceci is the Executive Director of Kaiser Permanente's Institute for Health Policy, where she identifies emerging health policy topics and guides the Institute's portfolio of work. So Ceci, go ahead and take it away. Ceci, I think, oh, good. Now, Ceci, you were on mute, but you should be unmuted now.
Okay, great. Thank you. It's a pleasure to be here and cover what I think could be a multi-day conference in about 10 minutes. So I appreciate you having me on today. Next slide. I'll just share a little bit about the Institute for Health Policy, frankly, as part of Kaiser Permanente. But the Institute is sort of a health policy think tank within Kaiser Permanente, and we look at a range of issues from a policy perspective, including supporting some of the work of Thriving Schools with health policy analysis. So Kaiser has been focused on schools for quite some time, and it is part of our business imperative, as 1 in 5 of our members are spend their time in schools. It's where we know behavior change can be shifted, and it's also really important from a life course perspective to know that education and educational attainment really impacts health outcomes later in life, just as much as health outcomes early in life can impact a student's ability to learn and engage in school productively. The other thing about schools, frankly, is that it's not just the students that we care about their health and wellness. It's really faculty, administrators, etc. Having a healthy school environment supports teachers and staff and helps boost job satisfaction and hopefully helps retain staff as well. So we know that schools and their environments play a really important role in the health of students and families. Next slide. So again, as I mentioned, health is really important to students. And if you could go to the next slide, please. Health is really important to students. And if we look at the number of elements that really touch health and their student ability to engage productively and meaningfully in school, there's a number of areas to look at. Housing, food, their environment, etc. All of these areas impact an ability of the student to learn and are also really guided by federal, state, and local policies. Great. So basically, since COVID and this national pandemic started, there has been a large array of federal, state, and local policies enacted to counter the pandemic. In particular, we can start with looking at the CARES Act, which provided $2 trillion in stimulus funding to battle the harmful effects of the pandemic. It created a $150 billion coronavirus relief fund for states, local, and tribal governments, as well as a $30 billion fund for education stabilization for states, school districts, and institutions of higher education. That $30 billion for the Education Stabilization Fund has various provisions, including provisions for elementary and secondary education, The funds that would go to elementary and secondary education would be $13.5 billion that would be distributed as grants to states. And those funds would go to LEAs and can be used for coronavirus response activities like planning for and coordinating during long-term school closures, purchasing educational technology to support online learning for all students served by the LEA, and additional activities authorized by the federal elementary and secondary education laws. Additional funds are going to governors to help with emergency support for LEAs as well. And then there is also funding for higher education. That being said, just that federal context, there has been quite a bit of policy happening in several states. And even though some states have postponed legislative sessions, there's been about 83 bills and resolutions passed in about 20 states, including the District of Columbia, that look at education sector in light of the coronavirus. So a number of states, including New York, Washington, California, New Jersey, and others, really have some of the most bills in play around coronavirus. And additional states, I think, are looking to continue legislating several areas, including employee pay and benefits, support for institutions, waivers of laws or fees, the number of school days, teachers' evaluations, a number of issues really critical to the way schools functions are now being legislated or regulated because of the virus. Another area is that schools really have been working, and school districts have been working with local health departments and to help support the spread of the disease. So some other areas that we're seeing are looking at coordination between schools, school districts, and local health officials. We're looking at policies about how schools are communicating with staff, parents, and students, cleaning and disinfecting. And then we're seeing an array of issues related to school meals in particular that we'll talk about a little later, as well as the provision of medical and social services for students. Next slide. So we'll talk a little bit about food here. So basically, in response to the coronavirus, we've seen the USDA and Food and Nutrition Services make some changes to their programming, including the SNAP and WIC programs, as well as the child nutrition programs that operate in schools. So what we've seen is a number of flexibilities in particular being given to states. So for SNAP, for example, states now have the ability to allow applications online via mobile apps, by mail or telephone, and can extend certification periods. So there's trying to offer maximum flexibility to support folks to enroll in SNAP. In WIC, we're seeing states postpone certain tests and extend certification periods for up to 3 months. In school meals and other child nutrition programs, states can combine operations from multiple entities to serve meals at centralized locations. And we're seeing a number of other policies really shifted to support maximum flexibility, like waivers around when school meals can be offered, who can pick them up. There we're seeing flexibility around parents being able to pick up school meals on behalf of students, and other types of flexibilities that are important to make sure that students are receiving nutrition even while they're not in school. Next slide. Another area that we're seeing a tremendous amount of policy movement is in telehealth. And so in particular, this obviously connects to more than just the school environment, but we've seen a massive array of policy changes at the federal level, allowing maximum flexibility for the use of telehealth services. So in particular, we've seen some provisions related to an actual dollars being moved to help support telehealth access and infrastructure, and toolkits being provided that provide guidance around various elements of a telehealth program. So the CARES Act itself provides $200 million for a connected care pilot program that would support healthcare providers to address COVID-19 by using telehealth with patients. What we're seeing in school-based health centers, though, and for many of you that are familiar with school-based health centers, many of them are operated by federally qualified health centers, local health departments, hospitals, or community providers. And while we are seeing school-based health centers in some communities struggle, and that might mean that they've had to lay off staff or furlough staff or reassign staff to non-school-based sites during the pandemic. Many of those organizations have been able to benefit from some of the federal flexibilities related to the provision of telehealth services. Next slide, please. So another area that's been really impacted is mental health. 1 in 6 kids aged 6 to 17 experience mental health issues, and including depression or anxiety. And many of these kids are children of color, may live in low income situations, and may be receiving support from a variety of service providers that can be typically coordinated through a school. And in the absence of being in the school context, I think families are having to navigate some of this on their own. And I think that technology has been used, as I mentioned earlier, to help support access to mental health services during this time. And a number of other policies related to privacy and confidentiality have also been sort of updated in the context of the pandemic. For this group, we have seen statements on in-person restrictions and increased telehealth usage being flexed during this time to remove barriers to access. We're also seeing guidance from the Department of Education, the Federal Department of Education, related to FERPA, which is the Family Educational Rights and Privacy Act, during coronavirus. So there is guidance that's available in that regard. And there are a number of basic policies and fact sheets that we can point people to. I think one thing to point out during this time is that as students who've received mental health services in a school environment through a provider at a school setting, kids that are now in home situations may not have confidentiality if they are receiving virtual visits. There may be other people in the home and other situations that arise, and I believe school-based health centers are really thinking about what will it be like when we go back to school. So next slide, please. Many service providers are moving ahead and thinking about what will it be like when the school is ready to resume. And a number of organizations, including organizations that represent school-based health centers at state levels and at the federal level, are advocating for additional resources to support these centers to be ready and able to provide services and frankly, even think about what uptake in services might need to look like as students have had lags in receiving services during the shelter in places. So a number of these organizations are actively advocating for resources to support this return to school. And we're seeing an active conversation right now about thinking about the trauma that students might be experiencing, not just as a result of the pandemic, but for students that are in a vulnerable situations in a home environment that may not be conducive to learning or to good mental health. We are thinking already about what will it be like to support those students to resume mental health services, et cetera. A number of other things to kind of watch is that many schools help coordinate access to oral health services, and there may be a lag now for some of those students. and families and receiving services, so there may be a backlog. And then I think things to think about include immunizations and how immunizations, and certainly as we think about an immunization for the coronavirus over the next months and years, what would that be like, and how will policy change to support access to immunizations in the school environment? So with that, I will say so much more to come on these issues, and just scratching the surface here, and happy to take questions. Next slide. And this is my contact information if folks would like to be in touch and have additional questions about any of the content here. Thank you.
Great. Thank you so much, Ceci, for that incredible overview and sharing more about the role that policy can really play in terms of shaping responses to COVID-19. We so appreciate that. Next slide, please. So before I hand it over to our next speaker, I just wanted to take a moment to build on all that wonderful information that Ceci shared and speak a little bit about kind of how these policy changes can impact work at the district and school levels. Again, my name is Alex Mays. I'm with Healthy Schools Campaign, which is a national nonprofit, and all of our work really sits at this intersection of health and education. We work to ensure all students and staff have the opportunity to learn and work in a healthy school environment. Next slide, please. So again, just building off of the incredible list, this list doesn't even touch on everything that Ceci shared, but right now there are tremendous changes in terms of federal and state policies that stand to impact the work that many of you all are leading in your school districts and schools. And so I would encourage you all to go to your State Department of Education's website and look at the resources and information they are sharing around COVID-19 and what these policies might look like in your states. So many states are doing an incredible job of tracking these resources and sharing them and being explicit about the policies that are on the books, and that can really inform the work that you all are doing at the district level, and really highlight opportunities that can present chances for additional resources to support the work that you're doing at the district level and in schools. So I just wanted to very quickly, before I hand it over to Erin, just share a little bit more about school meal program changes and telehealth as examples of what this work can look like at the district level. Next slide, please. And so as Ceci shared, there have been tremendous changes in terms of the school meal program. And what does this look like at the district level? We would love to hear from folks on the webinar. Type in, what is your district doing around school meals? How have these flexibilities been leveraged to support the delivery of school meals? We've been hearing about grab and go meals, drive-through lanes, school bus routes being repurposed to deliver meals. It really has been tremendous to see how districts are leveraging these flexibilities to do this work. And on the next slide, this is just one of my favorite examples from the largest school district in Georgia. They've repurposed school buses to deliver school meals. In a 2-week span in March, they delivered over 294,000 meals to students, and 83% of those were delivered via their buses. So they deployed all the buses that were typically doing school meal routes to deliver meals to kids, school pickup routes to deliver meals to kids. So just a really innovative way of leveraging these policy flexibilities at the federal and state level to support district work. Next slide, please. And then I just wanted to speak to telehealth. Again, as Ceci shared, tremendous opportunities around telehealth right now. What this looks like at the district level is it can be, expanded delivery of behavioral health services, speech therapy, nursing services, occupational therapy services. But in general, there are really tremendous opportunities at the district and school levels right now to not only be delivering these services via telehealth, but also getting Medicaid reimbursement for them. Next slide. And Virginia just provides a really nice example. They made some of these changes that now allow all school Medicaid providers. So this includes school nurses and speech pathologists and various behavioral health providers to be delivering these services via telehealth, including via telephone, to students that are in need of these services. Next slide, please. And so these are just some resources. Again, we'll share out these slides where you can access more information about what is happening in your states on this front, and then in turn better understand what can be happening at the district level. So I think next slide is my contact information. But then I will now hand it over to Dr. Erin Simon, who's going to share a little bit more about what is happening in Long Beach Unified. Next slide, please. Again, we would love to hear more about, the work that you all are doing in your states. But Dr. Simon is the Director of Student Support Services for Long Beach Unified, where she leads major reform efforts for the district. We're thrilled to have her here today to be sharing more about how this work is unfolding in Long Beach. So Erin, I will hand it over to you now.
Thank you so much, Alex, and I'm so happy to be with each of you today. Before we delve into the district supports, I would like to share with you its demographics, which will hopefully give you a deeper contextual understanding of the district's approach and response. So next slide, please. Looking at Long Beach Unified School District demographics, as you can see, just based on here, there are many communities that we serve in the Long Beach Unified School District. We are the third largest district in California with just over 71,000 students. There are affluent parts of the city, but there are also swaths of the city that have significant rates of low-income families and are considered as vulnerable neighborhoods. And to the right of the slide, you can see the ethnic breakdown that is currently in Long Beach. Next slide, please. So going into the paradigm shift, just like with many of you on this call, schools closed on March 16th and will not reopen for the remainder of the school year. And so with school closures, there has been like these paradigm shifts that have happened. And so with enrollment in California, we are required to enroll students up until the last day of school. So with that, when schools close, we immediately shifted to online enrollment only because we want to make sure that our students get educated and that they get into the system very quickly. And so with online enrollment, it still allows, where there's district policy, which allows parents to choose any school within the district for their children to attend, with certain restrictions. So, and there are most specialized programs which have some admission criteria, for example, and the desired school must have space available. So with that, before the districts closed, there was a huge focus on attendance rates and chronic absenteeism rates. And now there's a shift to monitoring participation rates with our students, which many of you guys are doing as well. And that's just looking at the frequency, if students log in, not just if they just log in, but are they engaged? Are they doing the work? And if not, who from the school site is contacting that student and their family just to check in with them? And for us, we want to be very conscientious and also come at this from an empathetic lens. So when we do contact our students and families, it's not so much, hey, you haven't checked on, you haven't logged on, what are you doing? Why haven't you been participating in the academic program? It's more so, how are you doing? And also, how can we help you? Is there anything the district can help you with as far as your basic needs, as far as shelter, and then kind of gradually move it into academics to see how we can help students engage in the academic process. Next slide, please. So before school closures, we were really honing down on our chronic absentee rates, and we had adopted this attendance band tool from an organization called Attendance Works, which allowed us to monitor students in specific chronic absence bands much more efficiently and effectively. So although there is a shift to monitoring participation rates, staff will still be contacting and closely monitoring students who are within the moderate and at-risk chronic absent bands before school closed, because we have this assumption or thinking, although we hate to assume, but many of our students who may not be participating, maybe also those students who are within those bands. So our school staff is still contacting those families weekly if they can, to just check on them and just make sure everything is okay. Next slide, please. So regarding basic needs, which this next slide is going to go into The district is leveraging its school nurses to reach out to families with a known history of health and attendance challenges, which are also those students who are within those bands that we talked about earlier. They're also working to distribute medications that have been left at the school site to parents if needed for use at the home. And then nurses are completing pending IEP assessments. As we know, IEPs are still moving forward. So still, having those conversations and working to complete those assessments. With our lunch program, as Cecilia mentioned, so I'm not going to go too much into that, but there have been much flexibility in regards to providing school lunches. So with the CDE, with them receiving the special waiver from the U.S. Department of Agriculture, it allows school districts to that previously operated summer food service programs to use federal funds to continue to serve food during the coronavirus-related closure. So right now we have free meals that are available at 34 LBUSD school sites, Monday through Friday, within a specific hour for our students 1 to 18. But that also includes our students who are in our adult community transition programs, who may be up to 22 years of age. And it has allowed LBUSD to adapt a playbook that we use to feed kids in the summer. So it's grab and go meals, which are handed out at select school sites. The meals are bagged or box meals, which often include lunch as well as breakfast for the following day. And now LBUSD has shifted to providing breakfast, lunch, and supper for our students for at least the remainder of the school year. So very excited that we are able to do that as well. We've also are providing food to our temporary shelters within Long Beach because we know that these are our most vulnerable students and may not have access to even walk or just drive or take the bus to many of our school sites. So we are delivering those lunch options, breakfast, lunch, and dinner options to our temporary shelters as well. And then we've created our community resource guide, which provides our families with more information on food, shelter, health, and mental health resources, that our families can tap into now. This is something that we are desperately want to do because we know that the basic needs must be satisfied before students can attend to their academic needs. Next slide, please. And as far as just academically, as we're moving to the next slide, as far as Chromebooks, LBUSD is working to be a 1-to-1 ratio between students and devices. Our Chromebooks have been distributed to our families who need technology within the household. We've also provided low cost or free internet, MiFi hotspots for families who may be in need as well. And district learning has been put into place, which I'm sure has been put in place for many of you on this call today. And then lastly, just for our students in special education, we now have materials in Braille for visually impaired students in need. We have assistive technology devices. We're at the home with consultation from our AT specialists, and so many more things that we're providing for students within the home just to ensure that certain requirements are being adhered to and complied with within their IEPs. Next slide, please. In regards to grading, as we know that students before COVID-19 were being graded accordingly, just based on the work that has been done. But after COVID-19, the district has embraced a do not harm policy. So we have different kind of philosophies for each level, if you will. So for elementary students, they're not going to receive achievement report cards. For our students in 6th to 8th, they're going to receive pass through fail final grades. And then our students in grades 9th through 12th will receive credit to no credit final grades. Next slide, please. And then for our family resource centers, so in an urban school system, students' needs are sometimes concentrated in specific areas. And then in such cases, it warrants a school-wide approach, which allows for targeted support while retaining some economies of scale and site flexibilities. So in collaboration with our community organizations and other stakeholders, we, through our LCAP process, our local control and accountability process, LBUSD identified the 26 sites which were identified as high need schools where duplicated students made up a large share of the population. And during the 2018-19 school year, we had these family resource centers that were created to provide more social and emotional support for students. So that work is still continuing. We still have our school counselors and psychs who are providing services to many of our students that were on their caseload, before COVID-19 hit. But we're also providing services throughout the district to ensure that the social emotional well-being of all of our students is also met with as well. And we're also just working out to working with our school counselors and psychologists to make sure they're emotionally well. They're taking in so much from our students, but we need to make sure and check in that they're okay as well. We've modified our suicide assessments. I'm pretty you guys have seen that maybe your assessments have seen this uptick. But we've modified that for our teachers and our counselors and psychs who are working remotely. So if they are working with a student on Zoom or another online platform or via phone, and if they feel like that student is in emotional pain, they can connect with a counselor or school psych to help complete a suicide assessment. And then there's also a protocol to state when 911 should be contacted, or law enforcement should be contacted if needed, but also when we should contact, our psychiatric mobile response teams or any other teams can help provide support for our students immediately. We're very heavy on SEL right now. And so we are providing weekly newsletters. We've created Google Classrooms for self-care for students and staff. We created these spaces for parents to connect to and reach out if they need more support. We are really working to ensure that our students are emotionally well, and we're not able to tap into all of our students, which I'm pretty sure is an issue for many of you guys on this call, but we're still trying to figure out how we can reconnect with those families that we've lost connection with. Next slide, please. And then the final slide just goes into what we're doing from a foster and homeless youth standpoint. So for our foster youth, just continuing with the way that we do work, as me being the district's AB 490 liaison, I'm ensuring that students are able to enroll at a very quick pace and with immediate enrollment. But we're still working with our CSWs, our social workers at the Department of Children and Family Services, just to ensure they're updated on what's happening in the district, and so they can also be another conduit to have conversations with families, just so they're apprised as well, just in case they don't get our calls, they don't get our emails, or whatever it may be. Then our homeless staff is still reaching out to their families, to their students. They're providing school supplies. They're ensuring that, again, our shelters have the necessary food that's needed. They're ensuring they have Chromebooks. They're ensuring they have MiFi spots if needed, or even access to internet and technology. And that's something that we're doing, not just per McKinney-Vento requirements, just because we want to make sure that our students are taken care of in that way. So the next slide I know has my contact information, and I want to be conscientious just based on the limited amount of time we have for this webinar. But if anyone wants to contact me just to learn more about what the Long Beach Unified School District is doing, whether that's from a policy standpoint or just from a creative and innovative standpoint, I would be so happy to speak with you in the near future. Thank you for your time.
Wonderful. Thank you so much, Erin, for that incredible overview of the wonderful work happening in Long Beach. We really appreciate you being on and sharing that. Next slide. And I want to thank everybody for sticking with us longer than anticipated. Again, I encourage you to reach out to the presenters with your questions. We will certainly take a look at some of the ones that have come in and respond and share the slides and additional resources that were mentioned. I just want to highlight that, as Annie shared, this webinar has been part of a series that the Alliance for a Healthier Generation, Action for Healthy Kids, Healthy Schools campaign, and Kaiser Permanente have been hosting, and all those webinars are archived at the link below. So I encourage you to check those out if you're interested in some of these other topics. And so with that, next slide, we just want to thank everybody for joining today. And again, thank you to our wonderful speakers, to Annie, Cecilia, to Aaron for sharing their expertise with the group. And we encourage you all to reach out with any questions. So thank you, everybody. Enjoy the rest of your day.